For the last number of years, I've been traveling the country lecturing to physician groups and healthcare practitioners about the many ways that gluten sensitivity can manifest outside of the gut. If it manifests in the gut, it's called celiac disease. If it manifests in the brain, it might be called epilepsy, or attention deficit disorder, or depression, or anxiety. And the person never knows that it's actually a wheat allergy that's triggered these different symptoms. If it manifests in the heart, it can be called idiopathic cardiomyopathy, and they're on a heart transplant list. If it manifests in the joints, it's rheumatoid arthritis. And there's so many ways that it'll manifest, and many people have heard about the many different ways that it'll show in your body. I'm going to be lecturing this year. I'm traveling the country, and we're going to be lecturing to healthcare practitioners all over the country with an updated presentation of the ways it manifests, the types of testing that can be done, and the treatment protocols. As you may know, the testing has been very inaccurate for too many people. If you have gluten sensitivity in your gut called celiac disease, and if it's severe, the blood tests are very accurate. But if you don't have severe damage in your gut, the blood test can be wrong 7 out of 10 times, and you're told it's okay to eat wheat when it's really not, because it's just not showing in your intestines. It might be showing in your brain, or in your joints, or in your heart, or in your kidneys, or your lungs. You might have asthma from this. But the blood test won't tell you that because you don't have the damage in your gut. There's new tests out, and I'm going to be going around the country lecturing on that, how to do these tests, how to interpret them, and what are the protocols to treat people with these conditions. When I come to cities around the country, the evening before or the evening after, depending on the date and the city, I'm going to do a lay lecture for the general public. 2 hours on the many ways that this thing can manifest. For example, 1 out of every 70 pregnant women admitted to the hospital for any reason whatsoever turned out to be a celiac patient. They had a wheat allergy affecting their intestines. 70% of those women had a poor outcome of pregnancy. It meant they lost the baby, or they had a preterm birth, or the baby was born with some problems. 70% of them. And 8 of 9 of these women, a year on a gluten-free diet, they had a healthy second baby. It was just an allergy that caused this. Let me give you another example about children. In the Journal of Attention Disorders in 2006, they said that all children with attention deficit disorder and wheat allergies, every one of them, you put them on a gluten-free diet, every one of them improved. Either the child acknowledged it or the parents acknowledged it. Every one of them improved in all 12 markers of attention deficit hyperactivity syndrome. Every one of them improved. If this were a drug, it would almost be mandated in many school districts around the country that kids take it because they think better and they do so much better in school. But it's a diet. It's a way of living, and there's no profit in it, so this is not being pushed by anyone. That's just a couple of examples, and I'm going to be talking about examples in the eyes, or in the heart, in the cardiovascular system, about epilepsy, about depression, about blood flow into the brain, how all these different conditions may be affected by gluten. And at these evening lectures for the general public, we're going to have local restaurants there that have gluten-free menus. We're going to have lists of all the local restaurants. We're going to have bakeries that have gluten-free products. And we're going to have doctors there who are coming to my all-day event the next day, so that you'll have a chance to meet some of these doctors. Who are the doctors in your communities that have been trained and know about this, that know what current state-of-the-art information to use in putting together an identification of gluten sensitivity, how to identify it, and then how to treat it. And it's going to be a $20 admission at the local hotel for this. And there will be brochures like this all over your city. There will be doctor's offices, the restaurants will have some information about it, the bakeries will have information. You can also go to a website, www.conquerglutennow.com, or you can call 866-787-5175 to register. I look forward to seeing you there. I hope that if you have the opportunity to come, that you will come and learn how gluten sensitivity may be affecting you and your family. Thank you very much.